a new patient in the clinic.
Mm-hmm. We talked about smoking as well as possible caffeinated drinks or sugar. What about red meat? Could that be a potential cause of pancreatic cancer? Too much red meat in a diet?
I don't think that's proven. You know, the dietary factors are very vague in pancreas cancer. For instance, red meat is more proven to cause lymphoma in males than pancreas cancer. But that doesn't mean that it's completely lacks of evidence, but it's just no large studies has been done that investigating if people eat vegetarian type of food versus lots of red meat is that makes a significant difference in the incidence. These studies are very costly and has to be large, involving thousands of people. So I think we are lagging a little bit behind on those to prove these suspicions.
So I have two more questions for you, sir. One, has there been any extensive research done to discover a cause or better options for treatment? Is there money being put into this?
Well, I think pancreas cancer is maybe discovered a little bit earlier nowadays because of two new techniques have been introduced. One is the endoscopic ultrasound, which is a new type of technology of doing an upper endoscopy, and the same equipment which goes into the stomach and into the duodenum has a little ultrasound probe at the end, and that can see through the wall of the stomach and the duodenum. And so if the large mass in the pancreas head exists, that can see and can get even a sample, a biopsy done through the scope. And that facilitated the early diagnosis of pancreas cancer. The other test is maybe MRI, MRCP can very accurately delineate the pancreas, and if there is a small mass there, you can see that. PET scan is not FDA approved for pancreas cancer, but it also can be adding valuable information. For instance, if you see something, a little enlargement on the pancreas, sometimes that can be a cystic structure called a benign pseudocyst, but you can be mistaken too, and could be a cancer. And PET scan shows an increased uptake that can be a sign that this is dealing more likely with a malignancy.
And my final question, if there is any, do you know of any potential relationship between diabetes and pancreatic cancer?
Well, that's an interesting question too. These are two common conditions. Diabetes is quite often happens in the general population, and pancreas cancer is maybe not quite as often, but it's, as you can see, is the second most common GI malignancy, so it's not quite rare either. And I think this is a little it's a little frequent coincidence, but beyond that, there is an association too, because the diabetes is caused by a lack of insulin production from the pancreas, and if a tumor develops in the pancreas gland, that can destroy some of those cells that making the insulin. And you do see that many times that pancreas cancer patients are actually diabetic, and I would say that we incorporating, when we telling medical students and residents about pancreas cancer, that watch for any patient who is a new diabetic and there is no other better explanation, to think about at least pancreas cancer as a possible cause of it. Sometimes the diabetes is diagnosed maybe a half a year before the pancreas tumor. So that's a very good point, that we should probably make the attention a little bit more to be doctors and general population also be more aware of the fact that a new diabetes patient should be at least thought on and ruled out, that make sure it's not a pancreas cancer causing it.
Thank you very much for your time, Dr. Auber.